My name's Alicia Melendez, and I am about to present my capstone and 5-year plan for the baccalaureate program at Lamar University. So a little background about myself before we start. I graduated from San Jac College Nursing Program, the ADN program actually, in 2016. I then joined the STAR-N program to better my skills and prepare me for the real world of nursing. I was a floor nurse for a year before I was offered the position of charge nurse. I have now been a charge nurse for a year as well. I do wish I had more experience before taking on this leadership role, but I have learned a lot while being charge nurse, and my staff have taught me what it is to be a leader. I work on a medical telemetry unit, a 43-bed unit. I have my certifications in BLS, ACLS, CPI training, and EKG training. I was a preceptor in the last few months before I started charging, and I really enjoyed educating our new nurses. I am and always have been on the night shift. At the completion of the BSN program, you are expected to be a competent, caring nurse who is successful in 5 learning outcomes, also known as constructs. This is the first one: humanity and society. Our goal is to practice safe and effective holistic patient-centered care to a variety of patients or clients in multiple settings from a global perspective by incorporating the theories and evidence-based practice. The course I found that I met this outcome was in 4550, Leadership and Management. Our assignment was Global Health PowerPoint. I presented a PowerPoint over disaster nursing, and I used my experiences that I had with Hurricane Harvey. I also incorporated Gene Watson's theory of caring. I feel like the outcome met was 95%. The second construct was Lifespan Health Continuum. The goal supports patients, clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. We also were to evaluate patient-centered care for patients, clients across the lifespan based on common and complex health needs and compromised multiple health states when considering multiple detriments of health. The course I found I was the most successful at completing this construct was in 4620, Compromised Multiple Health States. The assignment was community-based service learning, a PowerPoint, and in this PowerPoint I was able to hit on the importance of patients with diabetes, specifically type 2. Treatments that included medications and/or dietary. I showed nutrition slides on how we can better improve their diet if they didn't want to just be on insulin for the rest of their life. And of course support groups to help maintain that wellness, because we always need a good support system. The outcome met was 100%. The third construct was evidence-based practice and clinical reasoning. Goal was to synthesize clinical and judgment in nursing practice utilizing critical thinking, nursing process, research, and evidence-based practice. The course I found I met this outcome was in 4540, Care of Communities. We had a practicum project video, and I had the pleasure of presenting my video over those living with AIDS and how that affects those when in a natural disaster. I say pleasure because this project in particular hit home for me because my best friend is living with AIDS, and he was a huge helping hand in getting me to the right kind of meetings and introducing me to the right kind of people for better insight into this population. I feel like the outcome met was 100%. The fourth construct was patient and client-centered care. Our goal was to employ safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patient, clients, and members of the interprofessional and intraprofessional healthcare team. The course I found I was the most successful at completing this construct was in 4321, Nursing Theories and Online Education. The assignment was differentiated essential competencies paper. This paper took a lot of work for me to write because the references were so compact with information, I didn't know where to start. This